Okay, everyone. So welcome to Navigating Medicare and Medicare Updates with Carrie Espinosa. We're so glad that she could join us today. My name is Kristen Mertz, and I'm the Communications and Engagement Specialist here at Elderwerks Educational Services. Just a reminder that this event is being recorded and will be posted to our Facebook and our YouTube pages. Elderworks is a not-for-profit 501c3 organization. Our mission is to provide seniors and their families with information, referrals, and guidance to senior living, home care, and support services to help make the appropriate decisions for them. The guidance we provide helps seniors stay home well or transition successfully into a new senior living opportunity. We provide education on a variety of aging topics for consumers and professionals who work with seniors. If you have any questions throughout the presentation, feel free to add them in the chat box and we will get to them at the end of the presentation. And I will pass it on to Carrie. Thank you for being here.
Thank you, Kristen, and thank you everyone for joining me today. My name is Carrie Espinosa. I'm the proud owner of Horizon Benefit Services, and I've got 20 years of experience helping my clients navigate their Medicare options. A little bit about my agency, if I can get this to move forward for us. A little bit about my agency. I'm actually part of a bigger Horizon team. And our mission is to revolutionize the benefits experience by providing clarity and ease to insurance. Like, how refreshing is that, right? We're very big on empowering our clients to know how to choose and use their benefits. And what sets us apart is on the front end, we advise, we broker, and that's typically how we're compensated. And then on the back end, we also advocate for our clients. I actually just came back from Vegas a couple weeks ago where I had the pleasure of speaking at a patient advocacy conference. So we're a hire to retire solution, but today I am officially putting on my Medicare hat, and we're going to talk about Medicare. My goal is to help you be prepared to navigate Medicare for 2025 and avoid ANOC shock. Has anybody heard of ANOC shock before? That's when you get your annual notice of changes in the mail. If you haven't gotten it yet for 2025, you soon will be. And that's where your insurance company, usually Medicare Drug Plan and Medicare Advantage Plan, lists what the changes are for the upcoming year. I don't like surprises. I don't like my clients getting surprises. And I'm kind of keeping an eye on the chat, but I think I'm going to hit pause on that, and we'll come back to chat, at the end of the presentation. So with that, let's get into Medicare. And this actually, I borrow from the Medicare and You Guide, but I enhance it a little bit. So Medicare, and we'll talk about the different parts in a minute, has different parts and was never intended to pay 100% of medical bills, nor is Medicare completely free, right? There's a premium for Medicare Part B. While Medicare is a great basic foundation and it pays a significant amount of medical bills, most folks opt for additional coverage in order to make sure that their out-of-pocket exposure is not ridiculous. So normally in the Medicare and You Guide, you see the first option with original Medicare or Medicare Advantage, and the second option. What I like to add is there are also retiree benefit plans, usually mostly Medicare Advantage or health reimbursement arrangements. When it's a Medicare Advantage plan provided by a retiree benefit, it's different than the off-the-shelf Medicare Advantage plan. So I think it's really important to put that into another category just so that folks who are retired teachers or like the city of Chicago has a retiree Medicare Advantage program. I don't want you to think what we're talking about today is going to be exactly the same. And then there's also folks who don't need the additional coverage with Medicare Supplement or Medicare Advantage because they have TRICARE for life, or they're using the Veterans Administration, then they may or may not want some additional coverage, and same with Medicaid. But there's a lot of ways to mitigate the out-of-pocket exposure with just original Medicare. And we're going to focus today on what most consumers, the average consumer, has to choose from, which is keeping original Medicare, which are parts A and B, getting additional drug coverage and Medicare supplement coverage, or Medicare Advantage. Medicare Advantage is also called Medicare Part C. So let's start with original Medicare, and this is the same sort of diagram, but a different look. This is a little more playful look to the information we just talked about. I want to talk about original Medicare, the red, white, and blue card on the left-hand side. Original Medicare has two parts, parts A and B. A, you don't pay for, you typically earn that based on your working quarters. Some folks who don't have 40 working quarters do wind up with a premium for Medicare Part A, but for most of us, it's earned. And Medicare Part B, which has a monthly premium of $174.70 today, and that's the standard Medicare Part B premium. Higher income earners do pay what's called an IRMA surcharge. So the two parts of Medicare A and B, A covers the inpatient services, inpatient hospital, inpatient skilled nursing, hospice care. Medicare Part B covers the outpatient services, things like doctor visits, lab work, ambulance, outpatient surgery, etc. But Medicare doesn't cover everything. I like to say Medicare is kind of like Swiss cheese, and the holes in the cheese represent the gaps in Medicare. So a Medicare supplement is also called Medigap. It fills the gaps in original Medicare, and Medicare supplement plans are standardized according to letter in most states. Massachusetts, Wisconsin, and Minnesota are the exceptions to that rule. And then if you stay that route of keeping your original Medicare, getting a Medicare supplement to supplement your original Medicare, then you also want to consider a standalone Medicare prescription drug plan. The alternative to this is Medicare Advantage, Medicare Part C, and this is where a private health insurance company manages your Medicare benefits. So you think of that Swiss cheese Medicare card being handed over to a private health insurance company, like, I'm doing an educational, so I can't say insurance company names, but think of the different insurance companies that are out there, and they're going to manage your Medicare benefits. They have to give you the same or better than you would get with original Medicare, and most plans also include Part D. And just so everybody's on the same page real quick, Medicare Part D is outpatient prescription drugs. Sometimes Medicare Part B, B like boy, covers medications when they're delivered in a provider's office. But for purposes of this, we're talking about the outpatient prescription drugs. And then with Medicare Advantage plans, some plans include additional benefits like dental, vision, hearing. Some of them give a Part B give back or a partial Part B give back. I think they even wash your car on Thursdays. I'm teasing them, the last one. They don't wash cars. If they did, I would get one. So let's talk at a really high level about the comparison between Medicare Supplement and Medicare Advantage. And I borrowed this chart from United Healthcare, who does a great job in their Medicare Made Clear book at helping to explain the differences. So let's start by talking about doctors and hospitals. When it comes to doctors and hospitals with a Medicare Supplement plan, you can select any provider so long as they accept Medicare patients, versus Medicare Advantage, where Medicare Advantage plans have networks. You might see Medicare Advantage plans be classified as HMOs or PPOs, or even sometimes in other states we see private fee-for-service Medicare Advantage plans. When you have a network of doctors, like with a HMO, you have to stay in network. You can only go out of network for emergencies. On PPOs, you want to stay in network for the lowest cost share, but sometimes you can go out of network and pay a little bit more. So at a high level, that's the doctors and hospitals and how they work with the different types of plans. And I want to just say too that neither of these are good or bad. They're just different. Okay? Think of this as two different routes to our destination healthcare. When it comes to referrals with original Medicare and a supplement, you don't need to get a referral to see specialists. With Medicare Advantage plans, you may need to. So, for example, if you have an HMO, for sure you need to get referrals. If you have an HMO plan that's a point of service plan, maybe not. If you have a PPO plan that's Medicare Advantage, PPO plans offer the most freedom and you don't need referrals to see specialists. And when it comes to network with with Medicare and a supplement, there's not generally network restrictions. Coverage travels with you across the United States. If you move from one state to another, your coverage moves with you. With Medicare Advantage, you might have network restrictions, and as I already alluded, emergency care is only covered when you're traveling outside of your planned service area. Otherwise, you don't have coverage outside of emergency with the HMO. With a PPO, the network restrictions are not as limiting, and you can have access to providers in other areas depending on the insurance company and the plan. Some Medicare Advantage plans even cover foreign travel, but so do Medicare supplement plans. When enrolling in coverage for the first time, when you're first eligible for Medicare, welcome to the party. There's no cover charge. You can buy any Medicare supplement plan without medical questions, without medical underwriting. Same thing with Medicare Advantage. Outside of that initial eligibility period, if you want to change from one Medicare supplement plan to another, the new insurance company or plan that you're hoping to change to has every right to ask medical questions to determine your eligibility and your rate. There is a birthday rule in Illinois and some other states that can be the exception, but that only allows you to downgrade your coverage, not to upgrade your coverage. So not to go from a letter N to a letter G, but you can easily go from a letter G to a letter N under the birthday rule, which doesn't apply to everyone. It's the first 10 years following your 65th birthday, typically. And with Medicare Advantage, there's never medical questions. So if you're watching this presentation and you're 75 years old or you're 85 years old and you're thinking, boy, I'd really like to try a Medicare Advantage plan, easy peasy. They don't ask medical questions to determine your rate or eligibility. Just know before you make any changes like that what you're giving up in order to make that change, and make sure that you're okay with it. Again, I don't think either of these options are bad options. I think they're all good options. I just believe that an informed consumer is a happy consumer. When it comes to costs with Medicare supplement plans, you do pay a monthly premium. You pay a monthly premium in addition to your Medicare Part B premium. But for that Medicare supplemental premium, you have predictable and typically low out-of-pocket costs when you use your health care. With a Medicare Advantage plan prices range anywhere from $0 to $100 and something dollars. Again, in addition to the Medicare Part B premium, when you have a Medicare Advantage plan and you use it, you have co-payments for services like doctor visits, hospital stays, etc., but it's up to a maximum. So think of Medicare Advantage kind of like the insurance you had when you were working. And then prescription drug coverage. Medicare Advantage plans oftentimes include Part D, again, outpatient prescription drug coverage. Not all plans do, so you do want to be very thoughtful and intentional if that's the route you're going, to know what your plan covers and what it doesn't. With original Medicare and a supplement plan, you want to seriously consider purchasing a standalone Medicare drug plan. So let's just kind of recap for a minute. With original Medicare, you keep your A and your B. you fill the gaps with a Medigap, also called Medicare Supplement, and you buy a Part D prescription drug plan or seriously consider buying one. With Medicare Advantage, you've got A plus B plus D oftentimes equals C. And I don't know who came up with that math, but that's how that works. So let's keep going and let's talk about, oops, that took us back to the beginning. We don't want to go back to the future, do we? No. All right. Let's talk about Medicare statistics because I think there's a lot to be said in numbers. So 2-3 years ago, if we were having this conversation, I would say there's 51% of the population that chooses original Medicare over Medicare Advantage. And then last year, the scales tipped, and we had 52% of consumers choose Medicare Advantage and 48% choose original Medicare. This year in 2024, we're at 54 and 46. And I'm going to spend a little bit more time in this presentation talking about Medicare Advantage because it's growing in popularity and because, again, I think that numbers tell a good story. So here's what to know about Medicare Advantage plans. And again, there's different types. There's HMO, which stands for Health Maintenance Organization. There's PPO, which stands for Preferred Provider Organization. There's plans for people with special needs, and then there's private fee-for-service plans. I've not run into any in our market, but in other markets there are. HMO plans, HMO stands for Health Maintenance Organization, and that's where you have the primary care provider. That primary care provider is your liaison between you and your specialists and additional care needs that you might have. With a preferred provider organization or PPO, you have more choice. You might have a primary care doctor, but you don't need to go to them for referrals. And there's the option to go out of network for additional cost share. So PPO plans offer more flexibility. They also have coverage throughout the United States, whereas HMO will probably only have emergency coverage throughout the United States. And then special needs plans. So there's special needs plans for folks who have chronic health conditions like heart disease, like diabetes, end-stage renal disease, or on dialysis. I know somebody put in the chat that they were interested in learning more about that. That's something I would encourage a one-on-one appointment for, just because we can't get into the specifics of the different plans and what they offer in a group setting when we're doing an educational seminar like this. But you can see from this map, right, where the greatest concentration of Medicare Advantage is. And we got Michigan, looks like Maryland, Florida, and then I always get confused. I think this is Alabama. Yeah. So we see the states where Medicare Advantage is really taking hold, and then we see other states where it's not as popular, like in the Dakotas, and that has a lot to do, I think, with and I apologize, I said Maryland was dark green. It's not. It's the northeastern states. The states where Medicare Advantage is not as popular, that's typically because of how the plans and the providers negotiate. And the other thing, we'll look at a county level map in a moment, but you'll see that more rural areas seem to prefer Medicare Supplement over Medicare Advantage. Oops. All right, so let's get back to where we were. All right, so here's the county level map. And you'll see Lake County. I broke out the counties right on the Illinois-Wisconsin border. Lake County has a 34% Medicare Advantage penetration. Medicare Advantage has 44% in Cook County, 37% in McHenry County. And then the further out we go, the less penetration there is. In Wisconsin, you'll see it's been adopted at a much higher rate, with Kenosha County adopting it at 56%, Racine County at 64, and Milwaukee at 71%. Um, so again, not saying something's right or wrong, just saying that it's different. And we want to keep that in mind because that's going to help determine too if we're choosing Medicare Advantage, how many carriers we might have access to. In the areas where it's popular, we're going to have more options. The areas where it's not as popular, we'll have fewer options. And so with that, let's get on to Medicare Part D. And we're going to talk about the biggest changes coming to Medicare in decades. I don't know if anybody remembers back in 2006 what happened, but that's when Medicare Part D was first introduced. Surprisingly, that was also when Medicare Advantage was reintroduced. Medicare Advantage previously existed as a different name. I think it was the Medicare Cost Plans. But under the Bush administration, Medicare Advantage plans were reintroduced with the extra benefits and the prescription drug benefit. So why is Medicare Part D prescription drugs so important for consumers? Well, for a bunch of reasons. One, drug plan formularies change every year. If you don't know what a drug plan formulary is, it's kind of like the insurance company's recipe guide to the drugs that are covered, at what tier, and at what cost. So think of it as their little guidebook. Every drug plan has a formulary, and it's important to know when you're choosing your drug plan that your drugs are covered and what other drugs might be covered as well, should that change in the future. We also have preferred pharmacies. So certain insurance companies might have ownership in pharmacy, in the pharmacy relationship. Some of them don't as much, but there's insurance companies that prefer certain pharmacies. And so when you're looking at that, whether your drug plan is standalone or it's part of your Medicare Advantage plan, that's something that you want to be apprised of as well. And then guess what? Plans can be discontinued. Plans can be crosswalked. I will say, and I think I can say this okay, that there's a drug plan that some of our clients are on that's being discontinued, and actually a whole insurance company that's deciding not to provide Medicare prescription drug coverage in 2025. And then sometimes there's new plans that are available, new plans that might cover your prescriptions better, or it might provide lower cost share for some of the insulins and diabetic drugs that people are looking for. So I want to let me hit pause on this real quick. I want to share this with you. This is an explainer video that I've created for my clients that helps explain what the drug plan changes are that are coming. So I'm going to play this, and then we'll dissect it. I'm going to hit pause real quick. Can everybody hear that? If you would just put in chat for me so I know that you can hear it, that would be helpful. No, you can't hear it well. Okay. So that's a problem. I'm going to start from the beginning and take off my headset and put it by my speaker and see if that helps. So give me just a minute, and we'll take it from the top.
Medicare Part D, comprehending the effects of the Inflation Reduction Act of 2022. Significant changes are coming soon for Medicare Part D in 2025, all thanks to the Inflation Reduction Act of 2022. Here's a brief overview of the key points you should know. First off, bid farewell to the notorious coverage gap, or donut hole. In 2025, it's gone. Additionally, there's a new $2,000 cap on out-of-pocket prescription costs is being introduced. Fantastic news for those with expensive medication. We will also see a shift in cost sharing. Part D plans and drug manufacturers will be covering a greater share of the cost. Another key update is the introduction of the Medicare Prescription Payment Plan, M3P. This plan allows you to spread your drug costs over the year, making it easier to manage expenses without a large upfront payment. While these changes offer many benefits, they may also require some adjustments to your plan's costs and coverage. Medicare and the Horizon Benefit Services teams are here to help you navigate these changes during the annual enrollment period from October 15th to December 7th. Ask now to reserve your appointment before all of our slots are filled. We can start discussing plan options as early as October 1st. The care and service you deserve is on the horizon. Give us a call at 847-746-6115 or visit www.horizonbenefitservices.com. 2025 Medicare Part D changes, comprehending the effect of the Inflation Reduction Act of 2022.
Okay, so I got some feedback that somehow it stopped sharing. I'm not going to reshare this, but what I will do is make sure that everybody's able to get a copy of this, okay? So I apologize if the video was paused. We're going to talk through all these nuances anyway, so we'll just go ahead and get started with that. The big changes are the $2,000 cap and out-of-pocket spend, and the cost shift to the insurance companies and drug manufacturers. I want to share as we're talking about this because this did not hit the radar of, I didn't see any press releases. I accidentally came across this actually, where Medicare is actually providing a premium stabilization demonstration. And what that means is that the changes that they're implementing were so impactful, as I said in a prior slide. One of the insurance companies we work with actually decided not to offer plans next year. Some of the other plans came back with much higher rate increases. So this premium stabilization demonstration was introduced as a voluntary program so that the insurance companies didn't shock us as consumers. So I think the big impact of this Inflation Reduction Act is really going to be felt in 2026, more so than 2025 because of the stabilization. So here's the Inflation Reduction Act summary for that was kind of addressed in the video, but not completely. Let's talk about why the changes happened, what they are, and how they can affect you, and then what you need to do for next steps to be ready. So the Inflation Reduction Act, folks, I love legislation. This was signed into law back in 2022. Yeah, it's 2024 now. I'm thinking the same thing you are, I promise you. They implement these laws that don't go into effect for 1, 2, 3, 4 years, sometimes all of the above. And it's like, well, where did that come from? Oh, that was back from 2022. So the goal of the Inflation Reduction Act was actually twofold. There were climate goals as well as a focus for what they call vulnerable populations, including Medicare beneficiaries. The goal was to for Medicare to improve in several ways, including lowering drug costs, expanding benefits, and stabilizing prescription drug plan premiums. So you'll see over here on the left-hand side, it talks about the Part D benefit redesign. What that means in just plain language talk is that folks who previously didn't qualify for assistance with their Medicare drug plans, they expanded the eligibility for it. So the government likes to use all these acronyms. I'm going to try to simplify this and say that LIS stands for Low Income Subsidy. It's also the Federal Extra Help Program. It's different than Medicaid. So the Extra Help Program is a federal program. Medicaid is a state program. Prior to 2023, you had to have 100%. You had to be at 100% of the federal poverty level in order to qualify for the low income subsidy. That's it's changed now to 150%. So it expanded eligibility for the vulnerable populations. they can now qualify for prescription assistance. But let me just share with you too, most folks don't know that they can qualify. There's also drug price negotiating. The federal Medicare program is working to lower drug prices on 10 prescription drugs. And I don't have all of the drugs memorized, but I do remember, I want to say Eliquis was one of them. Eliquis, and there's another one that starts with an X that I can't think of off the top of my head. But there's 10 prescription drug plans that now the federal government, or 10 prescription drugs that now the government can negotiate prices on. And then also putting inflation limits on the increases for prescription drugs. So I don't know if anybody's aware, but there's really not been a cap previously on how much a drug manufacturer can increase the price of their drugs. In addition to those changes, there's also the change to who is paying for Medicare Part D. So Medicare Part D previously was primarily paid for by the government and by consumers. Now, starting in 2025, Medicare Part D plans have to pay more. What that translates to in everyday talk is that the insurance company is going to have to pay more. Drug manufacturers also have to pay more. Medicare beneficiary drug costs are decreasing. Now, when I hear this, it's natural to be like, oh, that's great, my costs are going to decrease. But having been in this industry for 20 years and having watched drug prices increase over time, what it makes me pause and think is, well, where does that cost go, or where is it intended to go? The insurance companies aren't just going to eat the cost and say, that's okay, we're not going to make a profit this year. The drug manufacturers aren't just going to say, oh, yeah, we'll eat our portion of that as well. I'm a believer for every action, there's an equal and opposite reaction. And I think that's why the government came out with that subsidy program or that stabilization program this year, was because of how that was going to impact folks. So for Medicare beneficiaries, this is what you need to know. Starting next year, you're going to have a $2,000 cap on your Medicare out-of-pocket. Now, on the next slide, we'll look at the Medicare prescription drug plan design and deductible, but can you guess which direction the deductible went? The deductible this year, by the way, is $545. Yeah, if you guessed that the deductible increased, you're absolutely right. And this $2,000 cap, it's also important to note that this does not apply to drugs that are covered under Medicare Part B. It's only for the outpatient prescription drugs. I also have a client who is on a very, very, very expensive cancer drug that she's now being told she has to go straight to the drug manufacturer to purchase. So it's not been clear, but I'm assuming that when you purchase a drug through the manufacturer and not through the drug plan, that's not going to apply to the $2,000 cap. Or if you purchase drugs using GoodRx or through Canada, something like that. So just be apprised of that and be prepared, right? The infamous donut hole has gone away. There's no more Medicare Part D donut hole. There's only the deductible, the initial coverage phase, and then the catastrophic phase before you reach the out-of-pocket max. And then there's this beautiful thing called smoothing. And with smoothing, what it's doing is it's taking your annual drug costs and allowing you to smooth them over a 12-month period. So an example is somebody who's on a drug that costs $300 every quarter. They would have the option now to pay $100 every month instead of $300 every 3 months. And while for some of the folks on the call that might not seem like a big deal, we do work with a lot of folks who just are really struggling to pay for their prescription drug costs at the pharmacy. So it doesn't change the cost of the drug in that case. I mean, we're already changing the cost, but it does change the financing mechanism. And your pharmacist is supposed to be the one who tells you that. The smoothing is actually managed through the insurance company. All right, so let's just revisit for a minute that Medicare Part D visual. Today in 2024, we have 4 drug plan coverage stages. Stage 1 is a deductible, which is $545. Stage 2 is the initial coverage phase, where you and the insurance company share in cost up to a threshold of $5,030. Stage 3, which is the infamous donut hole. And then stage 4, which is catastrophic. So somebody reaches that catastrophic phase today after they've spent $8,000 out of pocket. Starting in 2025, there's going to be 3 drug plan coverage stages. The deductible, which is increasing to $590. The initial coverage stage, where you pay co-payments or co-insurance up to $2,000. And then the catastrophic phase, where you pay nothing. We're getting ready to approach the Medicare annual enrollment period. There's a lot of different enrollment periods with Medicare. I have them all listed out here. This is actually a cheat sheet I keep at my desk. Most folks are initially eligible for Medicare when they turn 65, or they're otherwise eligible for Medicare due to a disability or end-stage renal disease. That's when you make your initial Medicare elections. After that, the only time that you can change your Medicare prescription plan or Medicare Advantage plan or enroll for the first time is during the annual enrollment period, which is October 15th to December 7th. We start to have access, as well as you do as consumers, to plans starting October 1st. Let me just say, based on my experience, take a peek, don't make a decision. To me, these are important decisions when it comes to your health care. While the plans are available October 1st, sometimes they have final changes that don't hit until October 15th. And you'll notice that says Medicare Parts C and D. Just a reminder, you can change your Medicare supplement plan at any time throughout the year. You just have to be able to pass medical underwriting or be prepared to pay a slightly higher rate. I actually have a client who was on a Medicare supplement plan. I helped her with the drug plan several years ago. I said, let's look at your supplement plan, even though I hadn't helped her with it. And she's actually going to be able to save $1,400 a year because she had been in her plan since she was 65. She never made any changes, and the price just went up, up, up. And because she's still in great health, now she's 85, that's why we're able to save herself such a substantial amount. So she can change her Medicare supplement plan now. She can't change her drug plan until October 15th to December 7th, and then that change takes effect January. There's also a Medicare open enrollment period that runs October 1st through March 31st. And that open enrollment period is really, really important to know, because during that period, you can make a one-time change to your Medicare Advantage plan. We've already received notice that if you're a patient at Endeavor and you're on a Medicare Advantage plan, I highly encourage you to go out to the Endeavor Health website and look at the Medicare Advantage plan changes for 2025. They're coming out of network with a handful of carriers. You don't want to be behind that decision. You want to be ahead of it. But let's say that you did miss it, and January rolls around, and you're like, oh, shucks, I didn't realize that my provider wasn't going to be in network. You can always exercise your one-time change during the open enrollment period to correct and enroll into a different Medicare Advantage plan if you want to keep your doctor. And then there's a general enrollment period, and I want to talk about this for just a minute because Social Security sometimes gets things wrong, and they enroll people during the general enrollment period when perhaps they shouldn't, or folks don't know that let's say that somebody did not take Medicare, and I'm going to use a veteran as an example. I had a gentleman who was 80 years old who called me up, and he's like, kid, I need better Medicare insurance. And I said, well, what do you have now? And he says, I have Part A. I said, okay, this happened to be a neighbor, so I knew Mr. Lee, and I said, listen, why didn't you take Medicare Part B when you were first eligible? And he says, well, I was using the VA for all of my stuff. He goes, but now I got something going on. I want to go out and do private sector health care. Okay. Well, from 65 to 80 years old, now this gentleman has a penalty on his Medicare Part B. So essentially, I'm not going to do the math because all of our brains would hurt. But instead of paying the standard 174 premium, he's paying about twice as much to get onto that Medicare Part B. And because he didn't have it previously, he has to wait until the general enrollment period to enroll. So he can't even start his Medicare Part B today. He has to wait until January to do that, and then it'll take effect in February. And then there's special enrollment periods, things like moves. If you move from one county to another or one state to another, that can create a special enrollment period. Or if your plan suddenly doesn't offer coverage anymore, or if there's a disaster. And a disaster can be anything from a flood to a hurricane out in Florida. To they actually had immigration SCPs in Illinois at the beginning of this last year. So that's the alphabet soup, or some of the alphabet soup of Medicare. And then here's the thing: as a consumer, know that we know you're being pulled in so many different directions. You're being told by your insurance company, oh, you should switch this plan. You're being called by telemarketers. Please, please, please be very careful. There's so many scams out there. I had a client say, Carrie, I got 2 text messages telling me my Medicare plan was going away next year. And I said, well, please don't respond to that. Call us first. Let us help you. There's lead generators and aggregators, and they run these commercials like the Joe Namath and the J.J. Walkers. And there was a year when they were advertising, get all of your Medicare Part B premium back. What they didn't tell you is this is a national commercial, and guess what? There's one county, Broward County, Florida, where you could get all of your Medicare Part B premium back. None of the other counties in the country offered such a sweet deal. But the lead aggregator used that as a marketing technique or strategy to get people to call, and then they would enroll them in coverage, or worse yet, they would keep their name and then they would sell them off to other insurance agents and brokers. And then doctor offices and Social Security. And I have clients who tell me all the time, hey, my doctor told me I should do this. And I said, great. Does your doctor know your financial situation? Does your doctor know about the other doctors that you're seeing? No, Carrie, they don't. I said, well, then let's just be thoughtful about taking that advice from them. I'm a big fan of working with specialists. If I have a heart problem, I'm going to a cardiologist. If I have a legal problem, I'm going to a lawyer. If I have an insurance issue, I'm going to an insurance professional. And then Social Security. Sometimes we'll have folks tell us that they enrolled in coverage through Social Security. I don't believe that's the case. I believe that somebody spoofed the local Social Security office phone number or made a programmed into their telephone outbound call system that it looks like the call is coming from Social Security. Know that you can always call my office. We're independent. We're absolutely happy to be an honest and trustworthy resource for you because we know how hard it is to just get truthful and honest advice. And as a consumer, you have choices. You have choices when it comes to enrolling into Medicare. And I put this chart together, 10 years ago when I was working with my clients because I wanted them to know that there's a lot of different ways to enroll, and you want to find the way that's going to be the best fit for you. So there's folks who work just for an insurance company. You call insurance company A, they're going to tell you they're the best. You call insurance company B, they're going to tell you, no, we're the best. You get where I'm going with this. There's independent brokers like myself. I'm part of a larger association called the National Association of Benefits and Insurance Professionals. Most of us have, decades of experience and a client-centered approach. There's also consultants. Actually, I was at the conference I was speaking to Medicare beneficiaries and healthcare advocates, and there was one of these consultants was there, and they charged $600 to help people navigate their Medicare choices. And she was bragging, saying, "Yeah, but we don't sell insurance." And I'm like, "Well, a good broker or good advisor isn't going to sell insurance. They're going to help their consumers or their customers make the purchase." There's call center agents. When you call into the insurance companies this time of year, I can almost assure you you're talking to a call center agent. You probably won't ever talk to the same person again. And then like the lead generators, like I shared, and then there's ship counselors, which I actually work with some of our local ship counselors. I think they can be a great resource. Um, I also think that when you enroll in coverage, if you want ongoing service, ship counselors don't enroll you, but just be thoughtful about that. And that's something that I wouldn't have known on the consumer side that made a difference. And then lastly, there's 1-800-Medicare and Medicare.gov, which I discovered a few years ago is really a call center that's outsourced by the government. So I share that information with folks as well because sometimes we think we're talking to government employees and we're not. So here's my final thoughts as we close out the presentation. First, I'm sorry the video froze up and didn't play, and we'll get the copy of that out to everyone. But right now, as we're getting ready to approach the annual enrollment period for 2025, we're facing the biggest changes to Medicare drug coverage, and that's whether that's part of a Medicare Advantage plan or a standalone drug plan. Overall, is your coverage meeting your needs? Do you already know that your doctor is not going to be in network for 2025, and do you need to start positioning for a change? Is your current coverage limiting your access to providers and services? If so, it might be time for a change. I don't know if everybody knows this, but I think it's helpful to know that there's a Medicare Advantage trial right. If you've never enrolled in a Medicare Advantage plan before, Medicare allows you a 1-year trial right to see if a Medicare Advantage plan is right for you. If you're dissatisfied before that year is over, you can switch back to original Medicare, buy a supplement without any medical underwriting, or return back to your original Medicare supplement plan, I should say, if you already had one. We have one Medicare supplement plan in Illinois that does not ask medical questions. You can get approved as early as January of 2025. Actually, if you are just looking at changing the Medicare supplement, we could even get you approved before that. And then watch for your ANOC. Don't have ANOC shot, your annual notice of change. The Inflation Reduction Act will likely mean shifts in your plan, and it's more important than ever to review that. The annual enrollment period is October 15th to December 7th. If you need me, call me. Happy to be a resource. I love working with Elderwerks and supporting the great work that Kristen and Jennifer and your whole team is doing in the community. So with that, I'm going to stop the share and we'll open this up for questions. I'll start with the chat. Oh, yeah, sorry, couldn't hear. Okay, so hopefully I answered most of everyone's questions. Looks like it was better to understand about Medicare and updates. For Janet, who wants to learn more about the kidney dialysis, I'm actually doing a presentation with the organ transplant group next month. If you want to reach out to me, I'd be happy to get you connected with them. Somebody who's going on to Medicare who's 60 years old, they're going on disability due to early onset Alzheimer's. I'm so sorry. That hurts my heart. Help them, Jeannie. Help them make the decision so that they get the right plan. A lot of my folks with Alzheimer's, they don't have a lot of medical needs, but getting access to providers and sometimes to the best of providers is the key. So you want to be intentional about the plan that you choose. Will copies of the slide presentation be emailed? Kristen, we didn't talk about that, but I think I'd be happy to share this with the video. And again, sorry that didn't work. Yeah, and then is there a fee to meet with me? Am I compensated by the insurance company if somebody purchases a plan? Yeah, so I am compensated by the insurance company if somebody purchases a plan. We do also offer our services on a consultative basis for folks who have to use certain brokers to get reimbursements to their employers, or for patient advocates who just need to get their head wrapped around the Medicare plans and how they work. And then lastly, is an ANOC coming later this year. I usually have it by now. Oh my gosh, Dan, you took the words right out of my mouth. Hurry up and wait this year, huh? Yeah. It's been very disappointing for us, and know that if you're working with a broker currently, we don't get ANOCs. We don't get notified of this stuff. We do go out and search it and try to make sense of things for our clients, but you'll be the first to get it. And they are late to the game. It's because of all these last minute changes with the Inflation Reduction Act.
Well, I want to say thank you very much, Carrie, for presenting today. It was a great presentation. Everyone seems to have enjoyed it and gotten a lot of good information. So we really, really appreciate you being here today.